The Community Connections program serves as an alternative to the traditional justice system. It gives participants potential to seek treatment rather than being incarcerated or facing other legal consequences. And through that treatment, we hope to kind of resolve some of the symptoms of their mental illness that might have been related to a criminal offense.
When my lawyer told me that it was a mental health court, I had this vision of what mental health conditions were. And so I was very against it at first. And he was like, you should do this program. It's only for a year. Don't look at it as a punishment. Ultimately, I decided to do it. But at first I was like, no, I'm not doing that.
We'll reach out to the patient and we'll do an initial assessment. We'll do what's called a Community Connections quick screen and just get some information about the charges. And then we'll do an intake and we'll do an assessment to figure out, is there a mental health diagnosis involved? What kinds of things does a patient want to work on in treatment? They can have their treatment from an outside provider who they might have already been seeing prior to coming through the Community Connections program.
It really opened up my eyes and I really could identify with it. I just started going to groups and doing the individual therapy. And I did the IPS program, which is the supported employment. And that's how I learned about the peer support position. They really encouraged me to apply for different jobs that I was like, I would never be able to do that. And they're like, yeah, I think you can.
We work out of both district and superior courts. So we take both misdemeanor and felony charges. We have separate judges for each court who are both great. They're fantastic for the program. Their understanding of each participant's kind of needs as it relates to mental illness. Sometimes we might get referrals from family members who had some type of criminal behavior and they know that their family member is involved in mental health treatment and want them to kind of get the help that they need. And those referrals go to Savannah Summers, our mental health court liaison. Once she gets those referrals, we'll get some releases of information signed so that we can kind of coordinate with the court.
I feel like that position really bridged the gap between the mental health center and the court system. Just having that friendly face there really helped me through my journey.
I've always been told that criminal justice is not clinical, so it is kind of the perfect combination of the two things that I love, therapy and criminal justice, and proving to people that they do intersect more often than not, and it is important to give well-rounded care to individuals who are involved in multiple systems.
The justice system isn't set up to be a treatment facility for folks that are justice involved. Particularly, Hillsborough County House of Corrections, where a lot of our participants in the program would serve their incarceration time. They have some services, they provide some medications, they do what they can, but they're certainly not set up like a full outpatient mental health treatment center like us. The individual therapy that we provide, the case management services that we provide, I think those are benefits that somebody can get here that they wouldn't necessarily get while they're incarcerated in prison.
People still need more training and they need to be able to learn what it is to help someone with a mental health condition, because a lot of them are just trained to deal with the criminal population or justice involved population, and they don't learn about mental health and what they need to do to de-escalate people and things like that.
Aside from the benefit of, just improving people's lives and getting them the treatment that they need, I think another thing worth mentioning is the cost savings that it presents to the county. So through the savings that happen when people are not incarcerated, so there's a certain amount per day that we calculate for somebody that would serve X amount of time for their criminal offense. We're saving that money to the county.
I really think that it saved my life because I was on a path where I was just going down. Even though I didn't realize it at the time, I really feel like that program helped me to see all of the things that I could be. 2018, I was working at a recovery center and they had laid me off. And a few months before that, in that February, my sister passed away in a car accident. She lived with a severe mental health condition in and out of prison for about 10 years. And at that time, they didn't really have anything like CCP for her to utilize. And so that really motivated me to get into the mental health work. Instead of being a part of the problem, it was about being a part of the solution and doing what I could do to help. I saw that there was one for a peer support position on the ACT team. I came in and I did the interview and they asked me about my lived experience, which was different because I was like, well, I've never really applied for a job and told them about all these things that I did, all these wrong choices that I made.
For our clients to kind of have someone who went through the things that they're going through, it kind of gives them that if they can do it, so can I type thing. I think that it's just very helpful to have someone who can see things through that lens that we often can't.
It's really scary when you walk into court and you're like facing charges and you don't know what's going to happen, and you're like, you know, my life is going to be, you know, a mess now. And to see someone who's done it and got through it and is now doing well really gives people hope that they can do it too.